the Biden administration announced a new mandate on staffing in nursing homes in an attempt to improve quality of care.
But it's getting some pushback now from nursing homes. Parker Brown looked into this. It is our 9 o'clock top story tonight. Hello there, Parker.
Good evening, Brian and Andrea. The Centers for Medicare and Medicaid Services, or CMS, updated their rule for minimum staffing in long-term care facilities, requiring more staff than ever before. Only 1 in 5 nursing homes nationwide currently meet the new standards, and some say that despite good intentions, it will be difficult to meet those standards.
Long-term care providers like the Good Samaritan Society have already been facing difficulties filling positions of need. Despite this, they have been providing high-quality care for residents. Good Sam Chief Operating Officer Amy Middleton calls the new regulations the wrong solution at the wrong time.
Thinking about what nursing homes and healthcare in general went through since the pandemic, it's been really hard. We live in a state where our workforce and our unemployment number is very low. The people plain don't exist. So to think that solving this problem, if you will, would be just adding people seems out of touch with reality.
Good Sam estimates that they will need to hire at least 100 additional RNs and 300 additional CNAs and CMAs to meet the regulations. At least one RN will need to be on duty 24/7, and hourly care requirements from CNAs, LPNs, and other positions have increased per resident per day.
CMS has given us a couple-year runway, but it just simply isn't enough time to be able to create this workforce. I wish CMS had put more attention into some meaningful solutions. How can we build that workforce that would be more meaningful than slapping a number and saying, this is the staff that we have to have?
Middleton says facilities in rural areas will be hit harder by the new standards, and that there are many unintended consequences if those communities can't find new hires.
I think this could have devastating effects on some of the rural, and I worry about the providers across South Dakota, not just Good Samaritan Society, having to make some really difficult decisions. If those decisions are made, it really affects a community in a very large way when one of the largest employers leaves. It also could create care access issues.
Middleton says that Good Sam is routinely meeting with legislators and colleges to find solutions to increase workforce numbers, but the numbers they're looking for now might not exist. The new regulations will be fully implemented gradually over the next few years. Brian and Andrea.
Parker Brown tonight. Parker, thank you.